We go now to Michael Chertoff. He's a former Secretary of Homeland Security and is co-chairing the task force focused on reopening the District of Columbia. He joins us this morning from Washington, D.C. Good to have you with us.
Good to be on, Margaret.
The Washington, D.C. metro area has the highest positivity rate of COVID in the country, according to the White House. There's still significant virus circulating here, according to Dr. Birx. Is it safe to open the Capitol?
Well, of course, the paramount concern has been safety. And the good news, at least in the district, is it looks like over the past 11, 12 days, we've had a steady decrease in new cases, and our transmission rate is now somewhat less than one transmission per person. So as long as that continues, we should be in a position to begin the process of reopening in about a week. But we're doing this in a very deliberate way. The mayor has set forth a series of stages which we've recommended, and the idea is to simply take it a step at a time and make sure while we're doing this, we're doing it in a way that maximizes safety.
D.C. is, the nerve center for the federal government. It is where members of Congress fly in and out of. There's just a unique set of risk factors here. Why do you think that there still is this level of virus circulating, and does that concern you at this point?
Well, obviously, we're concerned that you have virus at any level. We may have started a little bit later, for example, than New York and California, and therefore their peak may have been earlier. As I say, we are in the process now, at least, of beginning to see a decline. But as you point out, Margaret, we do get a lot of visitors and people coming into work who originate from other parts of the country. And that means we get more vectors coming in with infection than might be the case, for example, in a city where you don't get a lot of people from out of state. So that presents a unique set of challenges. And we're trying to work with our neighboring counties in Virginia and in Maryland, again, to mitigate the risk as we move forward.
Now, one of the recommendations that you put forward, whether or not the mayor takes it, is not to fully reopen schools for in-person learning until there is a vaccine. How would that work? What do you mean by that?
Well, the idea is, at least in stage one, to have distance learning, have it be done remotely. But then over the next two stages, which mean that we would have basically reduced the outbreak to isolated outbreaks. During the next period of time, we would slowly begin to bring students in. Those entering transitional grades or needing extra instruction would come in first. We'd make sure to maintain distancing in classrooms, to keep the collection of people in a particular classroom below a certain number, like 10. To make sure the same youngsters were together throughout the day so you don't have a lot of people mixing with other groups. And then to have present on staff people with health background and experience in case someone displays symptoms or some issue arises. And the idea would be eventually, during the course of this time, to basically reopen, but in a very measured and deliberate way.
Now, you, as we mentioned, ran Homeland Security at one point during the Bush administration. You simulated how to respond to a pandemic. Is the current administration running your playbook?
Well, I mean, our playbook, of course, was something that was built about 15 years ago. Some of the elements of the playbook I think we see running now. I know, for example, Dr. Anthony Fauci worked closely with us 20 years ago on this, and he's still very much involved and engaged. I think some areas where there's been perhaps a shortfall has been in the stockpiling of medical equipment and protective gear, which was not present in sufficient quantities when this began. And there was a bit of a delay, perhaps, in recognizing that we needed to deal with traveling from Europe, which turned out to be one of the major vectors for bringing the infection into the United States from other parts of the globe. But I always hasten to say that no crisis or emergency ever plays out exactly the way you've planned. What the planning should allow you to do is equip yourself and train yourself to adapt. And fortunately, we have professionals in the health field and in Homeland Security who do understand how this works.
Now, one thing in terms of planning we're looking at is the fall and the possible resurgence. That could overlap with the election. I know you look at election security. I want to read for you something the president tweeted this morning. He said, the U.S. cannot have all mail-in ballots. It will be the greatest rigged election in history. People will grab them from mailboxes, print thousands of forgeries, and force people to sign forged names. Some absentee ballots may be okay when necessary, but this is trying to use COVID for this scam. What should national security professionals be planning for the election, and should it include mail-in ballots?
I believe it should definitely include mail-in ballots. There's never been a demonstration of widespread fraud or misbehavior in mail-in ballots. Actually, many years ago, I prosecuted somebody who committed an election fraud, but it just was a handful of ballots for people who were incapacitated. The positive side of mail-in ballots is it allows people to vote without putting themselves at risk for long lines in actual physical election voting sites. The other thing we can do in addition to mail-in is to have many more sites for curbside voting, where you drive up and you can deposit your ballot right on the site and it's in lockdown. So having the most options possible is the best way to make sure people get to exercise their very important franchise as voters.
All right, Secretary Chertoff.